Imagine waking up to the news that your local hospital is slashing its budget by tens of millions, potentially axing hundreds of jobs, and you're left wondering how this will ripple through patient care. That's the stark reality gripping Cornwall residents today, as community members voice their deep concerns about NHS funding reductions and the looming threat of widespread staff layoffs at the region's hospitals. In this piece, we'll dive into the details of a recent public forum where these worries took center stage, shedding light on the tough choices facing healthcare leaders. But here's where it gets really interesting, and controversial, as we'll explore the pushback from locals and the official responses that might just spark a heated debate. Stick around, this is the part most people miss when it comes to understanding how budget battles can impact everyday lives. Concerned locals, alarmed by NHS budget cuts and the potential for significant job losses at Cornwall's medical facilities, brought their questions directly to Cornwall Council's Health Scrutiny Committee. One resident from Cornwall emphasized that these changes could unleash a devastating impact on how patients receive care. For beginners trying to grasp the big picture, think of it like this: hospitals are like busy kitchens in a restaurant, and cutting staff or funding is like reducing chefs and ingredients during peak dinner rush. The quality of the meal, in this case, healthcare, could suffer, leading to longer wait times, overstretched nurses, or even delayed treatments that might affect someone's recovery. The Royal Cornwall Hospitals Trust, RCHT, overseeing major sites like the Royal Cornwall Hospital in Trellisk near Truro, St Michael's Hospital in Hale, and West Cornwall Hospital in Penzance, disclosed 2 phases of possible job reductions just last month. First, they initiated talks with frontline workers, including ward supervisors and nurses, aiming to trim costs by more than £49 million annually. Then, they revealed plans to cut administrative positions from over 600 full-time equivalents down to about 450. However, the Trust has since announced a temporary halt to discussions on admin roles and an extension for clinical staff consultations, largely due to pressure from unions. These decisions have fueled protests right outside Cornish hospitals, highlighting the tension between financial necessity and maintaining a robust healthcare workforce. But here's where it gets controversial: these job cut proposals, which have ignited public outcry and demonstrations, were spotlighted during the open questions segment at Cornwall Council's Health Scrutiny Committee meeting on Wednesday, November 5. The gathering included high-ranking officials from NHS trusts across Cornwall. Leading off the discussion, Mr. Evans, a resident from St Austell, probed into the expenditure of taxpayer funds on a consultancy firm. As we reported last month, RCHT engaged Kingsgate Consultancy to oversee the job consultations, at a hefty price of £412,400 plus VAT, covering the period from February 24 to October 31. For those new to this, consultancies like Kingsgate are expert advisors hired to streamline processes, but critics argue that spending hundreds of thousands on consultants during a cost-cutting drive is like hiring an expensive decorator while your house is on fire. It might help in theory, but does it address the urgent crisis? To stay in the loop with Cornwall politics updates, subscribe to our weekly newsletter here, link to newsletter. Mr. Evans pressed further: who authorized the use of public funds for Kingsgate Consultancy amid the ongoing restructuring at Royal Cornwall Hospitals Trust, and how does the rapid pace of these changes, especially amid winter season strains, risk inflicting a devastating blow to patient care? The committee's chair, Green Party councillor Drew Creek, delivered a prepared response from the Trust. Kingsgate's appointment was greenlit by the RCHT board in February to fast-track the 2025-26 operational strategy, encompassing the organization's most ambitious cost-saving effort yet, totaling £49.3 million. Endorsement for this consultancy support came from the Cornwall and Isles of Scilly Integrated Care Board, ICB, which is a regional body coordinating healthcare services, and NHS England, following protocols for expenditures exceeding £50,000. The costs are fully covered by RCHT. Next, Mr. Seaborn from Truro questioned the feasibility of services under such financial strain, with substantial budget reductions of £49 million for Cornwall hospitals this year, added to over £30 million already slashed, and whispers of another £40 million in cuts looming next year. How can healthcare providers keep up? Councillor Creek shared the Trust's reply: healthcare must consistently pursue efficiency and enhancements, finding ways to boost productivity. The £49.3 million savings goal for RCHT in 2025-26, representing a 7% cut, aligns with similar targets across major acute care providers in the South-West and nationwide. A recent medium-term planning document outlines a transformation strategy rooted in 3 key shifts from the 10-year health plan. Impacts on services are evaluated through quality impact assessments to ensure any changes don't compromise care standards. Ms. Best from Bodmin followed up with a pointed query: are those in top positions at the Trust really open to letting patients endure hardships from privatization instead of re-evaluating highly compensated executive roles? This touches on a hot-button issue, the debate over whether healthcare should be privatized or remain publicly funded, with some arguing privatization could bring innovation but others fearing it prioritizes profits over people. Councillor Creek responded with, the Trust focuses on optimizing productivity and efficiency using current resources, enhancing quality and service delivery while achieving financial stability. We are dedicated to expanding and building services internally. In rare instances, external assistance for specific programs may be explored, but any alterations follow standard business case procedures. All positions, including senior management, are included in consultations about restructuring care group management and corporate areas, potentially leading to fewer roles. At the board level, RCHT shares several chief officer positions with Cornwall Partnership NHS Foundation Trust, which has already cut down on numbers and shared expenses between the two entities. Mr. Bramwell from Truro raised concerns about a restructuring at Cornwall Health that might force experienced staff into redundancies. With Cornwall Health undergoing changes that threaten layoffs for its most seasoned employees, does the committee see the value in keeping these highly experienced workers to uphold top-notch care standards? This is an example where retaining veteran staff could prevent knowledge gaps, much like keeping a skilled mechanic in a garage to avoid breakdowns. Losing them might save money short-term but risk long-term reliability. Councillor Creek noted, Cornwall Health CIC, a non-profit GP-led organization contracted by NHS Cornwall and Isles of Scilly ICB and NHS England for primary and urgent care, doesn't comment on specific employee consultations. Any changes adhere to proper HR protocols with full staff involvement, ensuring no compromise on service quality or patient safety. Finally, Mr. Albert from Truro inquired about the timing of hundreds of clinical administration job losses planned around Christmas, especially with new computer systems not set to arrive until mid-next year. Are there any measures to challenge the Trust on this? Councillor Creek outlined, the review of clinical administration at RCHT goes beyond just the new electronic patient record (EPR) system, which is a digital tool for managing patient data more efficiently. RCHT is obligated to deliver safe, affordable services, similar to how other industries adapt. The NHS must modernize and meet national mandates to curb spending on administrative functions, supporting immediate improvements and future EPR rollout. Importantly, RCHT is collaborating with staff to gather and consider their input on clinical administration, and by agreement, feedback will be reviewed on December 9 before refining proposals for full consultation. Liberal Democrat Councillor Ruth Gripper suggested the Health Scrutiny Committee might need to probe the Trust on these job loss talks, as proposed by Mr. Albert. However, she was informed that since the RCHT changes are operational matters, they fall outside the committee's direct oversight. Cornwall Council Strategic Director for Safe and Caring Communities, Alison Bullman, explained, the committee's role focuses on monitoring any unintended side effects from the restructure and ensuring accountability for impacts on frontline services. And this is the part most people miss. While budget cuts are presented as necessary for long-term sustainability, the real controversy lies in balancing fiscal responsibility with the human cost of healthcare. Is hiring pricey consultants a smart investment or a wasteful distraction? Should hospitals explore privatization as a lifeline, or does it risk turning care into a commodity? And what about the timing of job cuts during holiday seasons when demand spikes? Is that fair to patients and staff alike? What do you think? Do you side with the locals fearing devastating impacts,